Welcome to the Breech Birth Podcast. I'm Sasha Hopkins, private midwife, breech birth educator, and your host. This is a space to hear the real, raw, and powerful stories of women who have experienced breech birth in all its layers. Each episode features honest conversations with women who've experienced breech firsthand, offering insight and reflection. This podcast was born from the knowing that these stories need to be heard to inform, connect, and reclaim the story of breech birth. Whether you're navigating breech birth yourself, supporting others, or simply curious, welcome and thank you. The Breech Birth Podcast is independently created and produced. If you'd like to support the continuation of this space, you can do so through Buy Me a Coffee. Your support helps keep these stories being shared and accessible to women and families around the world, and you can find the link in the show notes. Thank you for being a part of this community. Hi, Gianna. Welcome to the podcast.
Hey, thanks for having me.
Thank you. Before we jump into your story, let's get our context questions. So whereabouts are you located?
I'm in the States. I'm in Georgia, near the Atlanta area.
And how many weeks were you when you had your breech baby?
39 plus 5.
And what kind of care did you receive in your pregnancy and your birth?
So for the majority of it, I was with a midwife group that has a couple OBs working with them. And then at the very end, I switched to a private OB that does breech birth.
Okay. And you had a vaginal or cesarean?
Yes, vaginal.
Vaginal, yeah. Awesome. Before you jump into your story, do you want to share a little bit about yourself just to give our listeners a snapshot of who you are?
Sure. I am a stay-at-home mom. I have 2 babies. I have a 22-month-old and a 6-month-old. And I enjoy just being a stay-at-home mom and living that life right now. Tired, but very much happy, and heart is very full.
Beautiful. So you've got 2 babies. Your first one was head down. Do you want to just give us a short version of that birth pregnancy experience before we jump into your breech one?
Yeah, so I was with the same midwife group for that pregnancy, and I had a very healthy pregnancy. All was good. She had a 2-vessel cord. So that was the only thing that they highlighted, that they wanted to keep an eye on her growth. So we had extra growth scans with her, but she was 7 pounds, 9 ounces, no complications. With her birth, I did have an epidural towards the very end. I was probably close to 9 centimeters when I got the epidural, and she was born less than 2 hours later. And she was healthy and everything went amazing. I had a doula for that birth, which I also carried her over into my second birth. She was with me. So that was nice to have her through both experiences.
Lovely. And was that in a hospital? So the midwives cared for you in a hospital setting?
Yes.
Yeah. Did those midwives have what we here in Australia call credentialing? So do they book you into the hospital as a private patient, provide care for you in that setting?
No, they don't walk you in. They are affiliated with a hospital, and then you go to that hospital, and one of the midwives, and it's a large group, so you don't know who you're going to get, and it could be somebody that you've met or haven't met because there's just so many of them. But unless you have a high risk or a complication, you'll be with a midwife as opposed to an OB.
Okay. Yeah. All right. Well, let's jump into your next story. So it's a short gap between the two before you fell pregnant again. You obviously knew what care you wanted for the next time. What did that look like at the beginning, booking in with your midwife and the beginning of that pregnancy, having a little one to run around after as well?
Yeah, so that was a surprise. I was breastfeeding my first, and I never got my period. And then all of a sudden I was like gagging when I was brushing my teeth, and I was like, uh-oh, this is one of my symptoms that I had with my first. And so we took a pregnancy test, and of course I was positive. So we were surprised but very happy. And I immediately texted my doula, and I was like, are you available for June? Because that was my due date. So she was with me. And then I wanted to go back to the same practice because that group of midwives deliver in a hospital that's known for being low intervention. They let you do a water birth if you want to. They have access to that. So that I chose that group because of the hospital mostly that I would have access to. I had a very healthy pregnancy. I liked all the midwives there. Everything was great up until the very end when they obviously couldn't accommodate a breech birth.
So did you have scans, like a 20-week scan?
Yes. So with my daughter, like I said, I had lots of scans because of the 2-vessel cord. And with this baby, I didn't. So I had the initial dating scan to figure out my due date. And then I had the 20-week scan. And at the 20-week scan, he was breech. But so was my daughter at 20 weeks. I wasn't concerned about it. I knew I had loads of time. And then when I spoke to the midwife after that appointment, after the scan, she's like, yep, that'll be your last scan. And I was like, well, are we going to check again to make sure he's like no longer breech? I don't know why that popped into my head at that time, but I guess it was in the back of my mind. And she was like, well, if we have a concern that he's breached, then we'll give you another scan. But like usually we don't need to do that. So that was the end of that for a while. And because we had so many pictures of my daughter in ultrasounds from my pregnancy with her, we were like, let's do the 3D ultrasound so we can have like another picture of him, because in the 20-week ultrasound, she only printed out like 2 pictures, and one was like his profile and the other one was like his penis. Like that was the snapshots of the 2 things that she gave us. So I'm like, let's do the 3D ultrasound. I think it was like 33 weeks I did that. And in that ultrasound, they were like, it's really hard to see him because he's transverse and you have an anterior placenta. So his head was like right behind my placenta. And I was like, okay. And I texted my doula and I was like, he's transverse. And she's like, don't worry, we have lots of time. And I immediately started on all the spinning babies. I had already been going to chiropractic, so I continued to do that. But the 33-week mark was kind of what jump started, like, okay, let's try to get this baby to turn.
Yeah. It's amazing that it's not uncomfortable for you, not realizing, because the transverse position, it's not exactly roomy.
No. Yeah.
Okay. So at what point did you let your midwife know?
The very next appointment, I told her, I said, I just had this scan done, because that was not a midwife appointment. I just scheduled that scan separately to do a 3D ultrasound. So at my next appointment, I told her, and she felt, and she said, I think he's head down. So I was like, great, wonderful. He flipped. And then at the very next appointment that I had, it wasn't a scan. She was trying to find his heartbeat with the Doppler, and it was not where it would have been if he was head down. And she was like, I think he's breech. And for the like last 5-6 weeks of my pregnancy, I could feel like a softball right at the top of my belly, like his head. It felt like a softball, and it stayed there the entire time. So I was like, okay, he's definitely breech. And I continued to do all the things. I got acupuncture. I did the moxibustion thing on your toes. I was doing like warm baths with ice packs on the top of my belly. And he just didn't want to turn.
Yeah. It was comfortable. And so at what point did your midwife say, this isn't going to work, we can't support you? How many weeks were you?
So she kept saying, like, he has plenty of time. And then I think at the 35, 36-week mark, she was like, so if he doesn't turn by 37 weeks, we'd like to schedule you for an ECV. And we do that at 39 weeks, and we do it in the hospital because an OB is going to do it. And I was like, okay, why do you do it in the hospital? And I had already started researching, and I was like, I was not really totally on board with the ECV because of things that I had seen of like risks, especially because I knew I had an anterior placenta. But she said basically what happens is the OB will attempt the ECV. If it's successful, they'll induce you right then and there so as to not give the baby a chance to flip back. And if it's unsuccessful, then, you can go home and we can try again a few days later, or you can opt for a cesarean if that's what you want. And then the other reason that they do it in the hospital is if there were to be a placental abruption or the baby's in distress, they would just take you for emergency C-section. So none of those options really sounded great to me. Because I didn't want an induction. Even if it was successful, I didn't want an induction. So that's when I started to have conversations with my doula about other options. So she came over and she was telling me, like, she was trying to be positive. He's still going to flip. Like, we're going to get him to flip, whatever. But if he doesn't, let's talk about your other options and the possibility that you're going to have a C-section. And I was like so anti having a C-section for many reasons, but she kind of broke down what that would look like. And I was like, no way. I don't want the baby taken away from me for hours. I don't want to be recovering from a major abdominal surgery, not able to pick up my, 18-month-old, not able to, do anything. So I broke down and I was like, I need to deliver this baby vaginally. And she was like, there's one doctor in this state that I know of that'll do it. or you can have like a home birth midwife. But my husband and I were not really like ready to wrap our heads around that at 36 weeks. So we were like, okay, let's go to this doctor. And she warned us. She was like, he's not the best bedside manner. He's very much his way or the highway kind of guy. And we're like, well, he's our only option. So we have to, go see him. So we went to see him, and he makes you bring your birth plan with you because you have to meet with him and talk to him before he'll accept you as a patient. And basically you sit down with him and he's just crossing stuff off your birth plan that he will not do. And you have to sign it and agree to it before he accepts you as a patient. So yeah, that was interesting. Um, I think he's like 80 years old or pushing 80. He's an older doctor, and he's very old school the way he does things. And in that interview with him, I was kind of realizing like what he does is not really breech birth, it's breech extraction. So that was hard to swallow because everything that I was researching, I was like, this is not the best way, but I had no other options. It was a C-section or that. So I signed off on all the things. Like he was like, I won't do delayed cord clamping more than 90 seconds. You have to be on your back. I'm not going to deliver with you in any other position. And I was having a lot of stress around that because I was like, this is not how I want to do this.
Yeah. Okay. Did you do anything to prepare yourself for that experience, like beforehand? Like having that appointment going, okay, this is my only option. How am I going to get through this?
Yeah, I had done so much research, listened to a bunch of podcasts on breech birth, listened to a lot of Dr. Stu, and Breech Without Borders, which one of the red flags for me was when I mentioned to this doctor Breech Without Borders, he had never heard of it. And I was like, you're the only doctor that will deliver
Living
breech and
under
you've
a
never
rock.
you've never heard of this? I was like, great. But my doula was like, you're just going to focus on the things you can control. You're going to do everything you can. I wanted to go unmedicated because I knew that moving around and having an upright position was the most beneficial for delivery, especially for breech. So my plan was just to do the best that I could to get the baby here and try not to worry too much about the actual moment of delivery. And I wasn't prepared for what it was going to be like because I didn't know what a breech extraction really looked like or what that involved. But yeah, it was like a whirlwind. I feel like I was not even in my body, so it was just kind of like it all happened so fast.
Okay. Before we go into that, do you want to start with how your labor started and what that looked like? Did you get to still see the midwife that you had at least, or?
So I think my last appointment with them was to get a scan that this new doctor required before I went in to see him. He wanted head circumference, abdominal circumference, and then the head to abdomen ratio scan. And he wanted the position of the baby, like if the baby was frank or complete. My baby was, I think it's called incomplete, where the one leg is up frank and then the other one is bent. So he was in that position every single time we had a scan. But then when he was delivered, he came out frank.
Okay.
So in that scan that I had, that was my last visit to my midwife. And I told them, like, I really want to deliver with you guys, but I'm not going to do a C-section. And if you guys can't do breech birth, then and they all were like, go for it. Like, good for you. So they were supportive.
So labor, what did that look like? So you're 39 and 5 when it started?
Yeah. Yeah. My water broke at 3:45 in the morning. I was asleep and it was just a massive gush that woke me up. And so I knew it was definitely my waters. And I went to the bathroom and I saw meconium and I texted my doula right away. And I was discouraged when I saw the meconium, not because I was worried about the baby at all, because I knew he's bummed down. So like it's just coming out of me. It's not the same concern that it would be if he was head down and, ingesting it. So I wasn't worried about him. I was just like, damn, this means I have to go in right away. I can't labor at home because I knew the doctor told me if there's meconium, then you have to come right to the hospital. So I told my doula and she answered me immediately. She was like, okay, don't worry. It's great. I'll meet you at the hospital. And now this is a different hospital than the one that I had delivered my daughter at. So I had never been to this hospital. I didn't really know much about it. So I called the doctor. He's like, yep, you can come in. We'll see you there. I got to the hospital around 5:30 a.m. because I think I took my time getting ready, getting cleaned up, and because I was not in any rush to get there. And I wasn't having contractions. So in the car on the way over, I started to have like very mild contractions, 7 minutes apart. And then once I got to the hospital, they stopped, they kind of halted. They brought me in. And then this is where I realized that this is a teaching hospital. So there's a lot of understudies and interns and people learning, doing their residency and learning. So that was an interesting part of it, was like my nurses and everybody was training somebody. So there was a lot of people in and out of the rooms. So I went in, it took them like 4 tries to get my IV. I was like, this is fun. And
So they're just letting the trainers do it. Yep.
exactly. So, oh my God.
For those listening, you can opt out of having someone who's training. As helpful as it can be for them, if you do not want that, then you just tell them. And that's any country, any hospital, because it is your body.
Yeah. And there was a point that I'll get to that I was like, nope, I'm not. Like, I didn't really mind people being in the room and like witnessing things, but I don't really need you to try out something when I'm like in the thick of it in labor.
Yeah.
So I wasn't having contractions at that point. They moved me to a birthing suite at like 6, maybe a little after 6 a.m. And they put me in the one that's like right next to the OR because I knew that when it came time to deliver, they were going to have me deliver in the OR. And that was one of the things I was stressed out about, was like, I'm going to be in the zone and then they're going to move me. And I was worried about that. But with my daughter, I had a pretty fast labor, and my doula was like, I want you to be prepared that this one could be different. It could be a lot longer because he's breech. But it ended up being an even faster labor. I think I was in the hospital for 6 hours before he was born. And so I got into the birthing suite, and it turned out to kind of be a blessing that I was there so early, because I really got a chance to we set the room up, dim the lights, got the music on, got in my zone there, as opposed to my daughters where I showed up 7 centimeters and I was frantic and they're asking me all the questions. So that was good. And I had really sweet nurses, and my doula was amazing. And then once I started to get to the point where I was like, I can't do this anymore. This is really too intense. And I need to know if I'm close, because if I'm not close, then I need the epidural. And so they hadn't been giving me any checks, which I was happy about. But because there was meconium, they're trying not to, the risk of infection, of checking me constantly. So I didn't have any checks. And then at that point, I requested a check. I said, I want to know where I am. And the nurse came in and she was like, do you mind if my trainee checks you? And I was like, no, I can't even, the thought of even laying on this bed for a check is killing me. I can't lay down. I'm like, no, this needs to be fast, and you need to just get in and get out, and I need to know where I am. So my contractions are a minute apart. As soon as one ends, I get on the bed to be checked, and she's taking a really long time to check me. And she's like, I can't really tell. It's hard to feel it. Blah, blah, blah. And then eventually I'm like, okay, get out, because I'm having another contraction. And so when she was done, she's like, I think you're 5 centimeters. And I was like, 5 centimeters? I know that I am not 5 centimeters. Because I know what I felt with my daughter, and I was further than that. There's no way I'm 5 centimeters. And I started to break down to my doula. I'm like, if I'm 5 centimeters, get the anesthesiologist. I can't do this. And my doula was like, you're not, don't worry about that. So the nurse brings in the anesthesiologist, and he was like, so do we want an epidural? And I'm kind of looking around, and my husband and my doula are like, no, she's got this. And I'm like, am I only 5 centimeters? And they're like, well, we called the doctor to come check you. He's going to be down in 5 minutes. So I'm like, okay, I'll wait for the doctor. And the anesthesiologist, I think he could tell that I was really towards the end, because he was like, just so you know, if she's complete, I can't do anything. So this is your chance. And I was like, no, let the doctor come down and check me. And when he came down and checked me, so he comes into the room and he's very abrupt, and he's like, so is she complete? And the nurse was like, I checked her and I think she's 5 centimeters. He's like, well, she sounds complete, because of the noises that I was making.
Yeah.
And sure enough, I was complete. And so he's like, prep the OR, and I'm standing over the bed. And now my body's involuntarily pushing. And I'm turned to my doula and I'm like, you're going to have to catch this baby because he's coming right now. And so then they make me get on the bed. They wheel me into the OR. And then as soon as I'm in the OR, my contractions slow down because now I'm in a room with bright lights and equipment and like 20 people. No joke, 20 people were in the room. There's
They don't even need to be in there. I just don't understand. They could be out of the room, and then if they're needed, call them in. Anyway, sorry, I'm having a rant.
No, I know, but they had like the emergency team, obviously, if it turned into a C-section, but then they also had all these observers and trainees because everybody wants to see a breech birth. So I'm like, what is going on? But I'm like out of body, so I can't even like worry about it. So he makes me get on my back. I'm already like uncomfortable. My body's like, everything's telling me I shouldn't be on my back, but I had no choice.
Are you still feeling pushy with your
Not
contractions?
when I'm on my back. When I'm on my back, I stopped having that involuntary like push that was just happening naturally. So now he's telling me to push, and he's like, don't make any noise. If you're making noise, like you're not pushing the right way. And I'm like, okay.
Because he would know.
Yeah, he knows a lot about that. And I like look at my doula and she's like, it's okay. Like just ignore him. It's okay. Because she knew after the fact. She told me, she's like, he's been known to kick people out of the room. Like he'll kick a doula out of the room if he doesn't like. So she was being very like supportive of me, like quietly, but not, confronting him about anything. So I pushed for 10 minutes. So it was like 3 contractions. But I pushed, he's coming out. I'm feeling the ring of fire. And as soon as like his little butt hits the air, he peed. So I'm feeling wetness, water on my leg, and he's peeing. And once I got past that initial crowning or rumping or whatever you call it in breech, then it was like I felt fine. I was like, okay, let me get him out. And they're pulling and yanking, and I'm feeling like the tugs, but it's not painful for me in the moment. I don't know if I was just like blacked out. And then they get to the end, and he's the whole time my doctor is having like his understudy doing this stuff. And
he's not even doing the extraction.
And okay. I heard him tell her to put her finger in the baby's mouth to tuck his chin to pull him out. Because now we're just down to the head. The rest of his body is out. And she tries to do it and his head isn't coming. And so the doctor's like, move. And he tries to do it. And it's like a matter of seconds, but it felt like forever. So he's like, get the forceps. And now I'm like, oh my God, this is terrible. What's going on? And obviously in hindsight, it's like, well, the baby was not sliding with gravity at all. You're having to pull him up towards the ceiling to mimic gravity. So he used the forceps, and the whole room is like screaming, like, push. It was crazy. And he pops out, and thank God he's fine. He just took a few minutes to start crying. So they whisked him over, and they gave him a little bit of oxygen. And I was telling my husband, I was like, go, be with him. But he was totally fine. They're calling to me from the little incubator bassinet thing, and they're like, he's good, he's breathing, he's fine, everything's good. And then in less than 10 minutes, they put him on me, and he was pink and he was crying and everything was good, thank God. But it was just like a whirlwind. And right after I delivered him, before I've even caught my breath, they're like, you have to deliver the placenta. We're giving you Pitocin. And they shoot Pitocin in my leg. And I'm like, what's like the rush? Like, but okay. And I think he was just trying to train people. I really think like he had his understudy basically like pull my placenta out. He had, I was like, did I tear? And they were like, no, you didn't tear. And I was amazed that I didn't tear with forceps. And he was like, there's a slight superficial tear. So he lets somebody like put in 1 stitch. And I'm like, he just did that so that like they could practice putting in a stitch, because I don't need that. But so that was the craziest part, was like all of that. It all worked out, and he was fine, and he was healthy, and he was 8 pounds, 14 ounces. He was a big baby. And yeah, it was wild.
Okay, so how long were you in the OR before? Do you go straight to the ward, a Snedder ward after that?
So they brought me into the OR. I pushed for 10 minutes, and then I was probably in the OR for like 20 or 30 minutes while they like put the baby on me, finished cleaning me up. Yeah, and then I was back into the birthing suite. They brought me back there first.
It's quite quick. That's a very quick boom, have a baby.
Yeah, it was quick. And like, I guess they had like a great team of people to come clean the birthing room while I was in the OR because there was meconium everywhere in that birthing room because it was just pouring out of me. So I came back and I was like, oh my gosh, it's so beautiful and clean. Wow. And I start breastfeeding. I had something to eat, and then they probably about an hour or so after that, they wheel me up to like the postnatal room where we stay. I'm like, I don't want to be here. Get me out of the hospital. Same with my daughter. I think I was there one night and I was like, let's sign the papers, get me out of here. So we were only there one night and my doctor came to see us the next day and he was like, yep, you guys are good. Everything's good. You can go. So yeah, it was quick.
Do they have a pediatrician do a once over on baby before you go?
They do. They have a pediatrician come to check the baby. They have a doctor come to check me. People I've never met before, of course, like, that work in this hospital. And then, they wanted to do all the screenings, like the hearing screening on the baby. They wanted to do all these little tests. And as soon as all of that stuff was done, the pediatrician signed us off that like he was good. So that stuff they had to do. But yeah, everything else was pretty quick.
Okay. And then so postnatally, did you see that doctor again or did you get care from those midwives that you had? What did the postnatal care look like?
So I didn't even really get care postnatally for me. I like talked to my doula. She came and visited, but because my doctor was like, you'll just come see me at the 6-week mark. And I texted my doula and I was like, do I have to go see him at 6? Like, I really don't want to. And she was like, if everything's feeling fine and you're not bleeding a lot. And so everything was fine. So I didn't get anything. For the baby, we took him to the pediatrician. He was born on a Thursday and we went to the pediatrician on Monday. And all was pretty good. My milk came in on the third day, same as it did with my daughter. So it was like the Sunday that my milk came in. And of course, the pediatrician, they're like, oh, he's lost some weight. And I'm like, I know, my milk just came in. Don't worry. Like, so he came back in a couple days later for a weigh-in. The weigh-in was good. And that was it. I had lactation consultant come see him because he had a tongue tie and it was pretty severe. It was like to the tip of his tongue. And we got that corrected very quickly because I went through that with my daughter and it was 6 weeks of just excruciating pain for me. And like she was miserable and working so hard to get just a little bit. And so this time around, I knew like that I wanted to address that right away. And after that, everything was smooth with breastfeeding and he was exclusively breastfed and still is. And yeah, then we got a lot of extra care for him, like physical therapy, craniosacral, chiropractic, because the chiropractic I knew we were going to do because he was breech. And he didn't have any issues with like his legs being stuck up. Like his hips were fine. We did the hip scan that they made us do, but he developed torticollis. And he had it was called a fibromastosis. I think it was like a thickening of the muscle on one side of his neck. And probably they think because of the forceps, like a traumatic delivery like that. That was only there for a few weeks. It went away. And, but he did have the preference of side that he would turn to and the tilt. So we took him to physical therapy.
Did that affect your breastfeeding a bit as well, like him feeding on a particular side?
He was fine with feeding on either side. He was a belly sleeper like since birth, and he always had his head to the one side when he was sleeping. So we took him to physical therapy at like 6 weeks old. He still sees this physical therapist. She was amazing. She did craniosacral work on him, which is super cool.
Highly recommend craniosacral therapy. It's great.
It's so cool. Besides the head tilt, his nervous system was like in fight or flight mode. His hands would be in fists, his eyes would be bulging, he would shake. And basically, I learned all this after the fact. This I did not research before I delivered him. But that when the baby goes through the birth canal head first, it sets their reflexes, that pressure on their skull. It sets a lot of things for their nervous system. So because he didn't go through that way, he maybe didn't get that initiation. And my physical therapist did the craniosacral on him and she said she was going to take him through the birth canal and she did something on his head with her hands And he immediately started doing the cardinal movements that a baby would do to be delivered. He dove down, he turned, it was wild. And after that,
Amazing.
he was a different baby. He was so happy because he had been colicky and miserable for like the first 8 weeks of his life. And he was like a different baby after that. It was really cool.
Interesting. I haven't heard that before, so that's fascinating. And the fact that he did all the movements as well.
Yeah. Yeah.
Very cool.
It was really cool. So now he's a very happy, chill baby, but he was tough in the beginning. And then looking back at like the pictures that I have from the birth, I'm like, no wonder he was pulled and yanked and like tugged on, like, you know, of course he was uncomfortable. It was really intense. Yeah.
Amazing. Thank you for having the experience that you've had now and knowing what you know now. If you got pregnant again and had another breech baby, would you do anything differently?
Yes. So I don't know if I mentioned, I did end up getting an ECV, but not with those doctors. I went to a private midwife that my doula knew. And it was unsuccessful, but she was a much gentler approach. Yeah, it was at her clinic. So it didn't work, but it was not, you know, the extreme situation that it would have been if I had gone to the OB in the hospital. Going forward, I would not even bother with an ECV. I just feel like if they're breech for a reason. I was always confident in my body to be able to deliver him that way. It was just the stress of not having the support and the system making it nearly impossible to do that. So going forward, and I already spoke to my husband about this, I'm like, we have to have a contingency plan for if we're breech, because by the time you even realize it's a problem, you're at the end of your pregnancy and then it's like chaos and you're scrambling. We have to have a plan going forward that, like, in case we have a breech baby, we know who's going to be our provider, and it has to be somebody that's skilled in breech, and it has to be somebody that not a breech extraction, somebody that knows how to deliver a baby breech.
Yeah.
Yeah. So that's our plan going forward.
So you've worked out what that will be. You know what your contingency plan is?
Yeah. So, well, we're hoping that we're not going to be in this state because we're from New Jersey and that's where all our family is. And we're planning to move back there. So hopefully by the time we have another baby, we'll be back there. And I've already found a group of doctors up there that do breech birth. If we're down here, though, we would probably go the route of a private midwife that's experienced in breech birth.
For home birth, that would be, wouldn't it?
Yeah. I would have to see if they do that at a birthing center, but if not, then it would have to be home. I really feel like if I was not in the hospital, it would have gone a lot smoother because I would have been in the right position and everything would have just happened the way it's supposed to, as opposed to what did happen.
Trying to push uphill.
Exactly.
Do you have any words of wisdom or advice that you'd like to share with anyone listening that has a breech baby?
I would say trust your body and trust your baby, and you know that baby knows what they're doing. And as long as you have a skilled provider, your chances of success are really high if you wanted to go vaginal. And then some of the resources that I used, I listened to Birthing Instincts with Dr. Stu. I listened to Evidence-Based Birth, and they have a couple episodes on that podcast that talk about the statistics with breech and kind of the flaws in like the major term breech trial that was done in 2000. That's like what everybody references as this big scary, why it's so dangerous to deliver breech. And they kind of go through all the flaws in that study and how it's an outlier and all the studies that have been done since. So for like my husband is a numbers guy. So that was helpful for me to show him, no, look, this is safe. So that was helpful. And your podcast I listened to quite a few stories, which I found really, really helpful, just hearing other women that went through it, and especially those who had a positive experience.
Yeah. Amazing. Thank you. Thank you so much for coming on and sharing your story.
Thank you. Thanks for having me.
Thank you for listening to the Breech Birth podcast. These stories matter. They stretch what we think we know and bring voice to experiences that need to be heard. I'm so grateful to the women who have shared their experiences with us, raw, real, and full of wisdom. If this episode resonated with you, please follow, share, or leave a review. You can find us on Instagram, Facebook, and YouTube at Breech Birth Podcast. And if you have a breech story to share, I'd love to hear from you. Until next time, may we continue to reclaim the narrative, one story at a time.